There's so many self-proclaimed experts, right? You don't need to be necessarily a medical doctor to be a trichologist, or certainly to give hair or scalp advice. So we are inundated with influencers, with self-proclaimed experts everywhere. And the biggest challenge that I have is to quiet the noise. So, I've spent a lot of time studying and learning, and I know quite a bit about hair loss and scalp disorders, but when somebody comes in to see me and they're overwhelmed and they're coming with studies and products, bags of hair, I'm there to quiet the noise and say, listen, let's talk about, you in this moment. What is the main problem that you're facing? And let's tackle that. And let's eliminate all the myths, all the noise. And I think that's where I really shine, is by sticking to science, sticking to facts, and calming out all of the misinformation out there.
On the surgery side, it's a little bit more, I would say, kind of black or white. It's, you're either a surgical candidate or you're not. And so for us, a big part of the consultation process is explaining, like, well, here's why you are a good surgical candidate, or why you are not a good surgical candidate, or sure, you might want to, do a transplant that covers this whole area, but actually it'd be better to focus on, the front half of the scalp, or whatever the case might be. So, for us, I think a big part of it is just giving, like, honest advice. I always say it's not a sales pitch. We're trying to give you the best advice possible because we want you to be, treated properly for the long term. And then again, a big part of it is, like, also talking about the education on the non-surgical side. So, and that's where we kind of dovetail on some of the stuff that we do is, surgery can replace hair that's gone and never coming back, but it's also important to be aware of the non-surgical treatment options that can still keep a lot of the good hair that you have, and maybe even stimulate some new hair growth. On the facial plastic side of things, it's kind of similar. It's, people come in with various complaints or concerns, and so a big part of it is saying, well, like, here are the things that we can address with surgery. Here are some things that maybe surgery can't do, and so maybe it's not the right treatment option for you. Here are some non-surgical treatment options, injectables or lasers or, other sort of non-invasive measures that maybe could address the concerns without having to go all the way to a surgical option. So again, ultimately, I think a lot of it's just like, it sounds cheesy, but it's like, what would you say if it was your sister or your brother or your mom sitting in the chair? And that's, I don't know, again, I know it sounds cheesy, but that's honestly how we want to think about it, because we want to do the right thing for people. Kind of a collaborative effort where, it's literally something as simple as, like, I'll send Caroline a text or an email saying, hey, I've got this patient with this issue. It's not really a surgical issue. What advice do you have? And so that kind of, like, consultative collaboration. Funny enough, we are in the process of kind of building out a joint clinic together where it can be like more of like a one-stop shop, medical, trichology, all in one visit kind of concept. So stay tuned for that.
Yeah, I think at the end of the day, and Ashlin had said this earlier, we're both really good at what we do, but then we're sort of limited and we have to come out of our, comfort zones and ask those questions. And we've been pretty great at doing that and being vulnerable and saying, listen, I don't know, in this case, is this person qualified for surgery, or do you think, what do you think? And so we try to make the patient journey pretty seamless right now. It's important for me to talk about the pre and post-op sort of care. I know I'm referring them to the best people in the business, and eventually one day, you can come to one place and get all those answers in a series of a few visits. Yeah.